Occupational therapists help children perform daily activities that they may find challenging by addressing sensory, social, behavioral, motor, and environmental issues. They help children gain independence and develop the skills they need in order to do the things they need and want to do. OTs work with children in the following areas: addressing difficulty with regulation and maintaining positive behaviors in all environments, improving fine motor skills and hand-eye coordination to improve play and preschool skills, learning basic tasks and helping with daily activities such as bathing, getting dressed, brushing their teeth, sleeping, and feeding themselves, evaluating the need for specialized equipment such as wheelchairs, swims, bathing equipment, dressing devices, or switches to access communication aids, improving attention and social skills to support play and interaction with peers and family. The Cvcda's OTs are Carlin, currently on maternity leave until May 2021, Kylie, Taryn, covering for Carlin, Nikki, currently on maternity leave until June 2020, and Brendan, covering for Nikki. They bring a wealth of knowledge and experience to the EIT team. To become an occupational therapist, you require a master's degree in occupational therapy. In order to keep up to date, OTs continue to take further education in areas such as trauma-informed care, feeding, sensory processing, and integration. Physiotherapy is all about movement, physical function, and quality of life. PT is frequently involved with infants and children who have a diagnosis of or at risk for neurological, developmental, cardiorespiratory, or orthopedic conditions or challenges. PT is one of the key members of the early intervention therapy team because, along with attachment and love, the first thing that develops after a baby is born is movement. Working closely with the child's caregivers, medical team, intervention team, and education team, the PT helps the child with the family's priorities such as learning new motor milestones such as head control, tummy time, rolling, sitting, crawling, walking, jumping, running, and using the stairs. Improving body awareness, balance, and coordination. Improving quality of movement, motor control, and gait. Using alternative methods of mobility to access their environment and socialize. Improving posture, strength, flexibility, and mobility. Improving breathing mechanics and lung function. Addressing atypical incontinence. Improving stamina and endurance. Participating in physical activity or accessing the outdoors. Gaining independence and exploring their environment. Preventing or delaying loss of function, pain, and the need for surgery in the future. Recovering from a muscle, joint, or bone injury, and much more. The Cvcda's PT is Mel, who can offer services in English or French. She graduated 5 years ago with a master's degree in PT, and since then has also done plenty of continued education and training in infant and child motor development, trauma-informed practice, cultural safety, caregiving coaching, pelvic floor rehabilitation, vestibular and vision rehabilitation, and advanced manual therapy. Speech-language pathologists Jennifer Lewis and Mary McKenna provide services that help children communicate successfully with others. SLPs work with families to support children who have complex medical needs such as autism, cerebral palsy, or cleft palate. The SLP also supports children's feeding skills and children with hearing impairments. In collaboration with the family and team members, SLPs address speech development to help improve clarity, stuttering, language development such as understanding and using words, combining words into longer phrases and sentences, developing grammatical morphemes, following directions, social communication such as greetings, asking questions, responding to questions or comments, interacting and playing with peers, taking turns in a conversation, storytelling, referencing others, and nonverbal communication. Developing communication may include the use of augmentative communication strategies such as verbal output devices, sign language, or picture exchange programs. Speech-language pathologists have a master's in speech and language sciences. Ongoing education our team has taken includes the Lidcombe program for early stuttering, Beckman oral motor protocol, picture exchange communication system, the neurosequential model of therapeutics, the Early Start Denver model, parent coaching, and many courses in cultural safety, trauma-informed practice, autism, and FASD. Our speech-language assistant, Tara, works with families and their children who have speech and/or language delays. She has a BA in linguistics as well as a graduate certificate as a communication disorders assistant. She provides one-on-one intervention as well as group intervention. Ideally, this involves the family. However, services can also be provided in childcare settings in collaboration with the childcare staff. As an assistant, Tara plans activities to target objectives that are written by the SLP. These objectives are steps required to meet the family's priorities. This program consists of an Aboriginal speech-language pathologist and an Aboriginal speech-language assistant. Janice Forsey and Jennifer Legary provide early speech and language intervention to children birth to 7 who have Aboriginal ancestry. Building relationships, celebrating strengths of a child and their family, and building on where their child and family are the foundation of this intervention. With the family, they create individualized programs based on what the families identify as their priorities. They combine speech and language therapy with cultural elements such as drumming, singing, and using culturally relevant teaching materials and games. As part of the Aboriginal Speech and Language Program, the SLP and ASLP have also participated in the baby honoring ceremony and recreating the village. Our ASLP has a master's in speech-language pathology, and our ASLA graduated from Grant MacEwan University with a diploma in the speech-language pathology assistant program. She has taken training in FASD and has a certificate in trauma-based brain functioning, touch points. Oshrat works with children and their families who are primarily requiring PT and OT services. In collaboration with the physiotherapy, occupational therapy, and/or speech-language pathology, the therapy assistant performs intensive therapeutic interventions individually and in groups for families and children who have challenges that are significantly impacting their ability to participate in everyday activities. This could include eating, sitting and focusing long enough to complete a craft activity or listen to a story, playing with peers, or following routines. Coaching families is a big part of this intervention as it supports families in identifying and using strategies that will help their children's development. Oshrat has her ECE certificate with special needs, courses in applied behavioral analysis, training in parent coaching, a certificate in trauma-based brain functioning, and autism navigator training. She has also taken training in autism intervention and autism outreach, as well as touch points. She has worked as a preschool teacher and a behavioral interventionist using discrete trial, pivotal response, incidental teaching, ESDM, and DIR floor time.